Close-ended and open-ended questions are an important way to gather information about our client stories. How do you identify them and when do we use them? That's what we're talking about in this video. Welcome to the Skilled Counselor. There are two types of questions, closed-ended questions and open-ended questions. Let's talk about each of these. The first type of question is called closed-ended questions. They're called closed-ended questions because they don't encourage our clients to elaborate or to continue telling their story. These questions can be answered with a short phrase or often just with a simple yes or no. So how do you identify closed-ended questions? It's often helpful to look at the stem or at the beginning of the question. One hint is that if the word you is the second word of the sentence, then it's probably a closed question. So for example, do you want to buy the computer? Can you help me with this math problem? Are you going to the Christmas party? Will you tell me why you aren't talking to your mother? Closed questions are helpful when we need information. In other words, we need the details of something. For example, if I want to know if a client is suicidal, then I might ask something like, do you want to harm yourself? And then follow up with other questions. In most cases, however, counselors try to avoid the use of closed questions, and there are really at least three good reasons for that. The first reason is because questions keep the counselor in charge of the conversation. The counselor is busy asking question after question, and there isn't enough airtime in the session for the client to fully explain his or her story. Counselors should emphasize the shared responsibility of the therapeutic relationship. Closed questions don't set the tone for this. So this brings us to the second reason. Because these questions can be answered so briefly, closed-ended questions result in clients revealing less about themselves, which can reduce our understanding of their situation. The third reason is, depending on how the questions are asked, closed-ended questions can be interpreted as advice giving. We call this using questions as statements. So for example, if I say to you, don't you think you should talk to your partner about the situation? The subtext of this question is that I believe you should talk to your partner. Because counselors need to stay neutral in their work with others, this isn't something we want to communicate to our clients. Just like closed-ended questions, it's often useful to look at the stem of the question to determine if it's an open question. Open questions generally begin with the stems what, when, where, why, and how. For example, when do you feel that way? Or how would you like to begin the session today? Sentence stems that begin with tell me and elaborate are technically commands, but they're generally heard as questions. Therefore, these also count as open questions. So, for example, tell me about a time when you were afraid, or elaborate on the reasons why you want to go to college. Open-ended questions communicate to the client that it's their turn to speak. Thus, they open up conversation and can guide clients to fully explore their situations. Open-ended questions put the client in control. Your client can determine how little or how much he or she would like to share with you. I also tell students that open questions can be one helpful technique to have in your pocket when you're working with clients who may not be good at verbalizing their thoughts. Whether you're asking closed-ended questions or open-ended questions, it's important to remember that questions don't convey empathy. Skills such as reflection of feeling and paraphrase do. Therefore, don't overuse questions. Instead, use them sparingly throughout the counseling session. Otherwise, your client may feel interrogated, and this could jeopardize the development of rapport. Thanks for watching our video on closed-ended and open-ended questions. Leave us a comment and be sure to like and subscribe. Thanks for watching.